In 2006, as the needs for mental health services in schools became apparent, a small group of professionals from the West Virginia Department of Education, the West Virginia DHHR Bureau of Behavioral Health, and the Marshall University School of Medicine had conversations about working together to provide a system of mental health supports for students in West Virginia schools. In 2007, a state-expanded school mental health steering team was formed between the West Virginia Department of Education, the West Virginia DHHR, Marshall University School of Medicine, and a couple of mental health agencies. The work of the steering team was formally approved and made official by a memorandum of agreement that was signed by the WVDE superintendent and the WVDHHR commissioner in 2007, showing a shared commitment to improving school mental health services for our students. The state ESMH steering team is now comprised of about 30 members, representing over 20 entities statewide. The ESMH steering team has developed a comprehensive expanded school mental health model and website, providing best practice resources to support schools and community providers in effectively integrating a system of mental health supports in schools. What is expanded school mental health? It is a collaborative approach where schools, families, and strategic community partners work together to improve school mental health supports by building upon core programs and services schools are already required to provide. Expanded school mental health is not reactionary. It is not the old model of a therapist coming into school to support only a few referred high-risk students, but rather an expanded model that is designed to support all students in developing skills that support strong mental health wellness. In other words, expanded school mental health includes prevention, early intervention, and treatment, otherwise known as a 3-tiered system of student supports. Let's take a minute to talk about each of these 3 tiers so you'll know what to expect when there is an expanded school mental health program in your school. Tier 1's primary focus is mental health wellness promotion and prevention. What does that look like in schools? The school delivers programs and services that support the growth of the whole child in building skills and knowledge needed to be successful in school, at home, and in the community. This includes teaching skills in everyday instruction to enhance wellness, prevent problem behaviors, and build resilience. Sample skill areas include peaceful conflict resolution, anger management, decision-making, violence, suicide and substance abuse prevention, and so forth. Examples of school structures that support Tier 1 include school counseling programs, advisor-advisee programs, anti-bullying programs, and positive behaviors interventions and support, PBIS. Tier 1 also includes a formal process to identify and refer at-risk students for further support in the expanded school mental health system. Tier 2 provides targeted supports for at-risk students who are identified with behavioral, academic, attendance, and social or emotional needs. Tier 2 services are provided in group and individual activities that target specific areas such as communication, social skills, substance abuse, anger, stress, and even mild mood concerns. The goal of Tier 2 is to support social-emotional growth, developing skills and dispositions to keep students in school, and reducing the need for mental health therapy. When Tier 2 services are not getting desired results, formal assessments and referral processes are used to ensure students can connect with more intensive treatment as needed. Tier 3 services include intensive therapeutic interventions that are provided by community mental health professionals in a school setting during the school day for youth with diagnosed mental health disorders. The goal of Tier 3 is to help youth overcome limitations that impair academic and social functioning. By working together, mental health providers and school staff are able to develop strategies to improve functioning, working together in the student's natural setting to treat disorders and adjust strategies as needed to enhance school success. When school and community professionals work together to deliver the expanded school mental health model, there are proven results in student outcomes, including improved attendance, behavior, academics, and overall social-emotional well-being. The West Virginia DHHR has provided funding and support for 40 pilot sites to implement the ESMH model. The Marshall University Technical Assistance Center and the State ESMH Steering Team partners with the West Virginia DHHR to provide resources, conduct training, and track outcomes that prepare schools to be best practice examples for other schools. The ESMH website is rich with resources to help your school and community teams effectively plan and implement best practices. We encourage you to explore our website at www.wvesmh.org and check out our many resources to learn more about our expanded school mental health framework. Please reach out to the Marshall University School Health Technical Assistant Team at info@mutac.org should you have any questions or need support.